Here's a good question. Do you really need to visit the doctor every year? And does it matter what type of doctor? Our first insider explains, starting with what is a general practitioner?
General practitioners really are pretty rare these days. A general practitioner is basically a medical doctor who graduated medical school and then did 1 year of general medicine internship. Most of us for the past several decades have gone much further than that in our education, doing an additional 2 or 3 years of specialized residency. We also take board certification exams, and some of us even continue to take those exams year after year throughout our careers. That makes a big difference.
Absolutely. I mean, the more experience you have with different types of patients and different diseases, absolutely. So, Doc, how meaningful or how important is having that relationship with the primary care provider? I know, a lot of folks end up going to their specialist because they had some condition, to begin with. But tell us about that role as a primary care doctor. What does that relationship, the ideal relationship, look like?
Well, the analogy I use, Henry, is, think about an orchestra that doesn't have a conductor and they don't even have sheet music. And that's sort of how a lot of patients go around within the healthcare system. They go see a cardiologist because they have high blood pressure. They go see an endocrinologist because they have diabetes. And there really isn't anybody looking at the big picture, making sure that the oboe player over in South Miami is on tune and that the violinist up front knows which concerto we're playing. So that's really what a primary care doctor does. We look at the big picture. We're also really the only ones who are focused on your preventive care.
Right, that makes absolute sense. I just want to take a quick moment to remind our viewers that you can call in and ask the doctor a question by dialing our toll-free number, 855-796-4475. We would love to hear from you. Now, research shows patients who are more involved in their health care tend to get better results. Dr. Tatiana Ivan has more. Let's take a look.
Hello, I'm Dr. Tatiana Ivan with Baptist Health Primary Care Family Medicine Center at West Kendall Baptist Hospital. You can help prevent medical errors by being an active member of your healthcare team. Research shows that patients who are more involved in their care tend to get better results. When you visit your doctor, make sure to ask questions if you have any doubts or concerns. Take a relative or friend to your appointment to help you ask questions and understand answers. Tell your healthcare provider about all the medicines you take. Tell them if you have any allergies or bad reactions to anesthesia, and keep a copy of your own health history.
Now, doctor, I just want to go back a little bit. We mentioned about the importance of having that primary care. I mean, I see them more almost like as a quarterback, right? They kind of can see, I'm going to make this this reference to a sports game, but they can see the whole field, and they're literally focused on your entire well-being as opposed to just one specific thing that a specialist might focus on. Is that a good way to look at it?
That's a great way to look at it, Henry. It's really it's really an issue of just having somebody who knows what everybody on the team is up to. We see it so frequently that a patient goes to their cardiologist, has a set of labs or a test ordered, and then they go to the endocrinologist, and guess what? The same tests got ordered again. So our job is really to make sure that everybody's talking to each other, that we all know exactly what's going on with the patient. And sometimes the primary care doctor might even say to a patient, gosh, you know what? I don't think your endocrinologist, we really need them anymore. You're very stable. So to go to your sports analogy, there might be times that we need a fullback in the game, and there are times that we might not.
Right, absolutely. No, it makes total sense. I mean, even from a personal experience, I've gone to doctors where they have no idea what tests I've done in the past, what are the doctors I've had, and it makes it'd be so much helpful to have that one person who knows everything that's going on in your life from your health. From a health perspective. So absolutely, it's unfortunate that doesn't happen enough, I don't think. A lot of people tend to go to their specialists right off the bat, and that's where things start to get a little disjointed, right?
Absolutely, and really that coordination is what sets a primary care physician apart from an urgent care center or an urgent care physician. Primary care, we're not just the doctor that you go to when you have a cold. We handle your end-to-end care, and we really are the one that should be coordinating your care, regardless of what specialist you go to.
Right. So let's talk a little bit about the importance of a wellness checkup. So a patient comes to you for their annual visit. What kind of questions are you asking in general? And then how far out of just the physical component do you actually start to assess the patient?
Right. So, annual wellness visits or annual prevention visits, or what a lot of patients call checkups, they're really a great opportunity to take a step aside from that shoulder that's hurting, or that toenail that's a little weird looking, or this rash on my rear end. They're really visits that are meant to be focused completely on, have you done your mammogram? Have you had your pap smear? Have you had your colonoscopy? So the questions that we really focus on with an annual prevention exam is making sure that we know all of that information, like their medical history, like their surgical history, what medications they're currently taking, and are they actually taking them? What medications are they allergic to? What's really changed in their health? What's changed in their family's health? And then we definitely dive deeply into lifestyle, into things like, how much alcohol are you drinking? What are you doing for exercise? How's it going with smoking cessation and with quitting cigarettes?
Right, and to that point, that's where you really can take a deeper dive into what's really could potentially be going on with that particular patient, why they're not following your prescription. It could be a relationship issue, it could be a mental health issue. So unless you take that deep dive, it's really hard to get a full picture of what's going on with that patient, right?
Right, and there's a specific wellness visit for Medicare beneficiaries called an annual wellness visit. And these visits, we really dive into patients' lives. We look for risks for falls at home. We ask them about how often they've fallen. We ask them about whether they're driving, what problems they've had with driving, really what help do they need at home? Can they still dress themselves, bathe themselves, shop for groceries, cook their own meals? So those visits for our Medicare patients are actually really vital to not just preventing disease and illness, but in actually maintaining their quality of life as they get older.
Ever wonder why your doctor won't fill a prescription for you? Head to our website, allhealthtv.com, to find out. And remember, if you have a question, please reach out. We'd love to hear from you. You can send us an email by visiting our site, allhealthtv.com, or give us a call at 855-796-4475.